Welcome to Health Talk. My name is Mary Gao and our topic today is tuberculosis. Today we have with us Dr. Gloria Wu, who is Chief Surgery of El Camino and Los Gatos Hospital. Welcome, Dr. Wu.
This is a great topic, tuberculosis, because currently there is an epidemic in Santa Clara County. In 2015, there were 180 cases. This year, and the year's not over, we have 195 cases. So we're really concerned.
And why is that we have this increase?
We think that as more people are coming, visiting from countries such as Vietnam, China, India, Africa, visiting or working in Silicon Valley, sometimes they were not tested, or sometimes they lived here for a little while in different parts of America, then moved to California. And the only industries that test for TB are healthcare workers or hospitals or people like myself, we're doctors, we're tested every year. So these people can work in various startup companies and not be tested, have a hacking cough at 3 weeks, cough up blood, have night sweats, fever, and finally when they go to the doctor, they're found to have TB. And so it's a shock for them and their families. Also, we have children who have new TB. So for them, this is very important because that means it's a recent case. It's important that people who have been to other countries briefly, even for a few months or for work, that they be retested or be concerned about it, because TB causes 3,000 deaths in the world per year.
So how can you find out if you have tuberculosis?
Well, many people will get a skin test, which they will put right here, and then you're asked to come back in 48 hours to see what happens. In many people who were born in countries other than America, they had BCG vaccination as a child, and people think that once you're vaccinated, this PPD test is positive. Wrong. Only if they test you in your first year of life, it'll be positive. So let's say you got it 20 years ago in Latin America, but now you're 21, 22 years old. Your PPD test, skin test, should be negative if you do not have TB. But once it turns positive, don't get another PPD test, because then your arm will get very sick, infected, red, and skin will slough off. So once it turns positive, it means that you have latent TB, you've been exposed, and the activity that's happening in your body is becoming active, and you need to be treated. So it's very important to be treated. Many people feel, oh, I had the vaccine and my PPD is positive, I don't care, I'm fine. Wrong. It's very important to be treated, because you can then have active TB, infect the rest of your family or your coworkers.
So what are some treatment options? Is it a very long process to get rid of tuberculosis, or
it's
what is it?
3 months with some drugs and 6 months to 30 months, depending on the severity of your TB. And TB affects the lung, but it can also affect your stomach, your spine, your kidneys. So the most important thing to watch out for is that if somebody has a hacking cough or a cough that doesn't go away for 2 to 3 weeks, coughing up blood, high fever or night sweats, a loss of weight, unintentional loss of weight, feeling tired, they should see a doctor. TB should be considered, especially if they've traveled from a country such as India, China, Vietnam, Africa, Southeast Asia. There are parts of the world that there's a lot more TB than in America.
So you said that tuberculosis could be in certain parts of the body. Is it different for every person? Do they
Well,
manifest
what happens
in
if you drink non-pasteurized milk and there's TB in the milk, you drink it and then you can get TB of the stomach. So it's very important to read the milk cartons and the various things that are sold fresh. It says non-pasteurized, so be careful. Pasteurization helps prevent the bacteria from being in the food. It's a filtering process.
And do the symptoms also come out the same or different for everyone?
Well, for TB of the stomach, sometimes it's very hard to find, because they're going to have stomach aches and they'll have symptoms related to the stomach, but they're going to have unexpected weight loss And sometimes if they go see a gastroenterologist, that's a GI specialist, that means that sometimes they will do endoscopy and they'll do biopsy and they'll find the little bacterium, the tuberculosis, bacilli, and they'll find it by biopsy.
So how can people like prevent this, or like what are some precautionary measures people can take?
Well, if their coworker is coughing for 2 to 3 weeks, they should wear a mask with your coworker and then tell a coworker to go see a doctor, and the doctor can figure out a TB skin test. People travel to these affected countries such as India, China, Vietnam, Africa, Latin America, and even though they're going there for work and it's a fancy hotel they're staying at, fancy conference center, they're still exposed to the rest of the population who could be harboring TB. So some people just get latent TB and their immune system takes care of it, but because they become run down or they get another exposure, they get active TB, becomes active, and they start getting this. So it's very important to have such a discussion with your healthcare provider. The two major drugs now are isoniazid and rifampin, and there's one more, a new one that will help you get rid of TB within 3 months. So all this, see your doctor about this.
Okay. Are the drugs, do they have any like serious side effects? I heard like, you know, being treated for TB is a really long and grueling process because of that.
Well, isoniazid, rifampin usually is a year for treatment. That was the standard treatment. There are newer drugs. Some of the newer drugs were developed because there's multi-drug resistant tuberculosis, and it's very important to find out who is the first person affected in your workplace or your family compound. That person, if that person has multi-drug resistance TB, they're going to view you differently because you've been exposed to a type of TB strain that's perhaps harder to contain. And it can become epidemic in the sense that you can infect everybody in your cubicle area or everybody in your apartment building and everybody on a plane. There was a case a few years ago, somebody had TB on the plane, they didn't tell anybody, and they had to track down everybody on the plane, find them, test them, and watch for TB symptoms.
So what are some risk factors? Like, is it more likely for an elderly person to get tuberculosis?
People with their immune response that is depressed, such as people who are HIV positive, the very young, little kids, the elderly, if they're old. We had a death in Santa Clara County. This man was in his 90s, and despite treatment, he died because even though he was treated, his immune system was not good enough to handle the tuberculosis. So it's important to know that if you have any of these symptoms or you think about it, especially this is flu season, so people have a hacking cough all the time, but you have to ask, do you have high fever? Are you coughing up blood? Do you have chest pain when you cough? Is it so hard that you have chest pain when you breathe? Then to see a doctor, and then ask for a TB test, because you don't want to be missing it, have something that you can suppress and you keep getting this cough and then it becomes full-blown TB and it destroys one lung and then it goes into other body organs.
So you mentioned that there were many types of TB. What are the types that are out there and what should we watch out for?
The other types that are out there are usually for people, they're in the Mycobacterium family, and they usually affect people who have cancer or HIV. So that's not the type of TB that we think about with the PPD skin test. So they're rarer. However, again, go to the doctor and they will find out about this. And you can go to an infectious disease specialist or you can be referred to an infectious disease specialist because there are subtypes of Mycobacterium. In addition, besides the PPD test, is the quantiferin gold TB test, which is a blood test. So that's a different test, and it's specific for people who already have had a PPD positive test and were successfully treated in the past for TB, but they want to know if they've been reinfected, and so there's a blood test.
So is this like a better version to get tested?
It is more precise,
Okay.
slightly more expensive, but the insurance companies will pay for it usually.
Okay. Well, since there's an epidemic now, is this like a new disease, or is it just like an old disease that's been around for a while?
It's an old disease, and what happened the last 5 to 7 years, in India, there's been a huge increase in people with drug-resistant tuberculosis that were not treatable by isoniazid and rifampin, and they went through the list of other drugs. So they were resistant to 3 drugs. Then they became resistant to 5 or 7 drugs. Oh. So most of those strains are in India, but because there's so much travel between India and America now because of high tech, because of tourism, because we're a global economy and a global tourist trade, people are worried about that coming to America. We do see cases of this in America more frequently now than 20 years ago.
So what's the cause of this multi-drug resistant tuberculosis?
Perhaps originally they were treated inadequately, not enough months, or were given the wrong treatment, and the bacterium became resistant. They developed within the body a different type of bacterium that's still within that same classification of tuberculosis bacilli, but they just cannot be killed by these antibiotics. So this is why people say it's bad to have our children use the antibiotic soap, the antibiotic dishwashing liquid, all these things, because you're not letting your immune system do its work. So if your immune system already saw all these other antibiotics, when you really need them, it doesn't work.
So if you get tuberculosis, does it make you more likely to get like another type of disease or any?
Oh, there are comorbidities.
Yeah,
they feel that there are people with tuberculosis sometimes have diabetes, have heart disease, have kidney disease, have end-stage renal failure. And so all these diseases set up your immune system to be not functioning 100%. So you're unable to fight TB, or you need longer treatments. So all these are very all these topics we have to think about when we think about TB and going to your doctor. So you have to try to take care of yourself totally as a whole person, be as healthy as possible. And we're very lucky in California. We have many, many days of sunshine compared to the East Coast or the Midwest, and that we can try to be outside, work out, be healthy, eat healthy, and we have a lot of fresh green vegetables here, and we can try to eat healthy food to really try to be a healthy person.
So if I feel like I'm having some symptoms of tuberculosis, what kind of doctor should I go to?
Well, first you can go to your internist or your primary care doctor, and you can go to the San Jose, Santa Clara County Public Health. There's a phone number that we're going to list at the end of our program. You can call them. There's a TB hotline. You can email them, fax them. It's on the web. Look up TB Prevention Santa Clara County or TB Prevention. And there's a lot of government-sponsored websites, because obviously this is a disease that America does not want to have. It comes in close living quarters, so things can spread that way. But the symptoms are like more than 2 to 3 weeks of a cough that will not go away, coughing up sputum, coughing up blood. When you cough, it hurts to breathe, or when you're breathing, it even hurts. You get chest pain when you breathe, because obviously it's gone into your lungs. Night sweats, fever, and the fever is cyclical, and weight loss, unexplained weight loss. So it's the cough. Remember, all the cough, when you're coughing and when you're talking, there are little droplets in the air, and those are carrying contagious little bacteria that can come and attack your friend, your family member, your wife, your spouse, your husband, your children, your coworker, your secretary, your boss, etc. So, it's important to have good hygiene, like always cover your mouth when you cough, wash your hands, use a tissue, dispose of the tissue when you blow your nose. Don't just sneeze and just smear it all over yourself. It's not good. And teach your children the same.
So, other countries, they have the BCG vaccine. But how come Americans don't tend to get this?
That is a public health issue that since the 40s, and I'm not sure right now why, but currently we've never had the same level of need for TB vaccination as India, China, and other places. What interests you about TB and your, let's say, your college-age students, and what bothers you? What would be of concern?
I guess so far it isn't a really big concern amongst young people. I feel like a lot of people think it's like a really outdated disease and it doesn't exist. I'm pretty sure though some people might have had family members like the elderly who actually like die of TB because of the compromised immune system. But so far I think because it's not really a pressing issue amongst the young people, it's not a big of a concern and people aren't aware of it.
Right now, there are software engineers with TB being treated, and the current rise of 195 cases in 2016 in Santa Clara County, the majority of them have been tech workers. So they're young people. They're not 65. They're like 20 to age 40. So
Wow.
It's a huge group of people that, and a few children. These are family members of these tech workers. So because we have so much influx of tourism, also a lot of people coming from other countries to do our software development, are working with hardware. So we're in a great county in the sense that we have full employment. Everyone has a job, but you're bringing people closer and closer together, especially in these cubicles, working 18 hours a day, doing projects, especially in startups, that they ignore that they have this cough and they think, oh, it's just the flu. But you never know, it could be TB. So if your coworker is coughing next to you, maybe you should say to the coworker, you should get a TB test. And then the rest of you have to be checked as well.
So if I'm like an avid traveler and I like to go out of the country, should I go to my primary care physician and get some advice on what I should do to protect myself?
Of course, if you're traveling to all over, there are all these guidebooks about traveling to places that nobody goes to, like to, hiking in Nepal, going to, the outreaches of in mountainous regions in India, to Sri Lanka, to Southeast Asia, to Laos, Cambodia, Vietnam, to the western parts of China where there's no civilization but beautiful landscapes, to Africa. Definitely see your primary care doctor. There's a travel advisory network. It's a website. It's sponsored by the U.S. government. In fact, every country you go to, you can look up what the U.S. government says about that country, about the health, the related diseases that are there, and what months they occur, and the vaccines that you should get. And certain countries require visas. Those countries will tell you you need these vaccines even before you go into the country. So there's a travel clinic at Stanford. There's a travel clinic at Good Samaritan Hospital. There's a travel clinic at all the major hospitals. You just call them up if you have these questions about where you're going. And you can look them up on the web. The government websites are Center for Disease Control, CDC, and it's important to know.
Have you seen any interesting cases of tuberculosis in real life yourself?
I'm an ophthalmologist, and we see tuberculosis in the eye. It's called uveitis, and it comes in a certain way. They lose vision. They sometimes lose vision gradually. The sunlight bothers them. And usually we ask them where they come from, and once they mention they're from one of those countries, we think about it. And in addition, inside the eye, there are little white spots that we see. So this is important that ophthalmologists be aware that there is a little epidemic right here in Santa Clara County. all the major medical centers, the Department of Ophthalmology, all know about TB in the eye. It is one of the big problems. Uveitis is the third cause of blindness in the world, the third leading cause of blindness in the world. It's the number 4 leading cause of blindness in America. And because there's more TB coming into Santa Clara County, we're expecting to see more. Similarly with Zika virus, it also goes to the eye. So all these abnormal viruses go to the eye. Ebola virus went to the eye, also a uveitis. So these are major things that we think about in ophthalmology. And it can cause total blindness if not checked. So if people are at home and they feel that they're not seeing things well, they have eye pain, their eye is bright red, the lights around them are very bright, like they can't even stand being in sunlight. The sunlight makes them feel pain in their eyes. They have something more severe than conjunctivitis. They should see an ophthalmologist, and we're the group of doctors called IMDs. We go to medical school, so it's very important. We would then do blood tests to see if it's tuberculosis, and if it's so severe, because it's sometimes people forget to test for TB in the blood, and sometimes the ophthalmologist keeps thinking it's rheumatoid arthritis or something like that. Sometimes they need to even do a small operation, a biopsy of the fluid in the eye. And then it's in that biopsy of fluid, we will see the little tuberculosis bacilli swimming around, and then we know that it's gone to the eye. When it goes to the eye, it can be very bad.
What's the consequence?
The retina becomes very swollen, and it can have areas where it no longer functions. So then there is total blindness.
So if someone's in a later stage of uveitis, is there any way to regain that lost eyesight?
There can, if they make the correct diagnosis, and they would then treat that person, if it is tuberculosis, with the tuberculosis drugs such as isoniazid and rifampin. And sometimes they need to be hospitalized if they are multi-drug resistant.
So someone with uveitis can make a full recovery?
They can, depending on what the cause is. Now, uveitis can also occur in people with an autoimmune deficiency, in the sense that they are elderly and they have rheumatoid arthritis, have been chronically taking prednisone or taking cancer agents, they have cancer, so they can get uveitis in that other way.
So if I have uveitis and then I get cured of my condition, would I still have to go to another doctor to get rid of the tuberculosis in my body?
Probably that there would be a team approach. The ophthalmologist would work with your internal medicine doctor and the infectious disease doctor to make sure it's not in other organ systems, such as lung, spine, kidneys, and stomach.
So all doctors of all specialties are trained to treat tuberculosis?
It's one of the biggest diseases that cause death, you know, for the last 100 years. It's just that in America we haven't seen so many because we've been very fortunate, except that right now in California and Silicon Valley we have a lot of travel between these countries where people have active TB and are not treated.
So the number of cases in our county, how does that compare to the rest of the United States?
So our number of cases is greater than 38 states in America.
Wow.
So we have more cases of TB this year than 38 states in the U.S. So obviously we're not happy about that as doctors. We don't want our patients to be sick and then spread it to other people.
And this is just because the fact that the Santa Clara County has so many people of different ethnicities.
We have 160 languages spoken in Santa Clara County. So we have many people coming from all over the world. In some way, it's an international area because all the major high-tech companies are headquartered here. And there's a wealth of talent here for high-tech and software, new companies, and many people come here for that reason, either to visit for a month, to do an internship, or they're on a brief visa just to learn from somebody or some mentor or some company, or they're just here for 6 months because they need their expertise from other countries. And even if the multinational companies, Google, Apple, Facebook, they have engineers from all over the world, and many of these engineers come from those places, India, China, and Southeast Asia, where TB is rampant.
What is the government or like the doctors or hospitals doing to better the situation now?
Well, there is funding for it because TB is so big a concern in Santa Clara County. They're now going to all the schools and talking about TB risks, and they're no longer getting PPD on everybody based on state money. They're just asking people to have a PPD test so that private insurance pays for it. But they're trying to get that taken care of so that kids do not infect other children in school.
Well, if a kid gets TB, is it a really serious situation, or
they have to be treated with two drugs, and they have to be taken care of, and they have to be after 2 weeks of treatment, they are no longer contagious. So need 2 to 3 weeks of treatment. So they have to be probably taken care of, like be at home and separate from people.
So being at home is sufficient enough? They don't have to be in the hospital?
No, they don't have to be in the hospital. Sometimes there's a visiting nurse to make sure that they're away from people. And sometimes people don't listen, and that's why we have cases that become multi-drug resistant, because the person does not take their drugs according to instruction. There are many homeless people with TB that nurses are following around in the homeless shelters. They forget to take their TB medication. They don't take it. They don't have the money to take it. They take it and they stop it too quickly. And so TB is not out of their body, and they become a source of a carrier. They can then give more TB to more people. So that's why it's very important that the homeless population be taken care of and not have TB as well. And also the HIV positive patients who are living longer and longer, they are more at risk for getting TB if it's in the air droplets.
So what is the take-home message of all of this?
Oh, the take-home message for everyone at home, the home audience, is that if you know anybody who's coughing, or you yourself, you're coughing 2 to 3 weeks, and you cough and you can't breathe, your lung hurts to breathe, when you cough you have chest pain, or when you breathe you have chest pain, you have night sweats, fevers, you lose weight inexplicably, it's not because you're trying to diet, you should really consider a TB test. You should call the TB hotline. That's the San Jose and Santa Clara County TB information line. Go look it up and get your questions answered. And a PPD is very cheap. It's a skin test. And if you think you had the vaccine before, the BCG, you can get the quantiferon gold test, a blood test that's covered by your insurance. Thank you so much for listening to us.
Thank you, Dr. Wu.
Thank you, Mary.